Millions of dollars worth of US-funded contraceptives have been stuck overseas since February. About 20% of America's annual contraceptive donation to Nigeria has been affected, now caught in a web of policy changes and halted logistics. On its part, the UK has rolled back its foreign aid budget by 40%, pulling funding from critical women's health programs and shifting its spending to other areas such as defense. These developments are shrinking access to contraceptives not just in Nigeria but across the sub-Saharan region.
More women are now demanding, but unfortunately they are not getting the services. One, based on lack of commodities, shortage of commodities in some of the sites. About 70% of our health products are imported from outside this country.
Public health data paints a troubling picture. Demand is rising, but supply can't keep up. Nigeria's unmet needs for contraceptives has climbed from 19 to 21%, highlighting growing gaps in access. On the ground, women face inconsistent availability, soaring prices, and fewer options, all of which drive up the risk of unintended pregnancies and pressure on already strained health system.
Even when you go to the facilities, there's always been an issue of it's available today or it's not available, and it's not available tomorrow. So sometimes when you step into a facility, you are not completely sure what specific FP commodity, with family planning, what specific contraceptive is there.
In terms of price, it's now high, unlike before, and also there are varieties of contraceptives that don't even work.
Health agencies are partnering with government bodies to strengthen supply chains, improve distribution, and avoid future stockouts. But some experts argue the long-term solution lies in reducing foreign reliance altogether. They're advocating for domestic manufacturing of contraceptives to cut costs and ensure steady access.
Some of these commodities we are talking about are manufactured and procured overseas, and they are quite expensive to bring into the country. So can we produce locally? If we produce locally, possibly it will be cheaper for women to have access to.
With international aid drying up and critical stocks still stuck abroad, Nigeria faces a tough challenge, one that experts say demand urgent investments in local alternatives to keep family planning programs alive. Failure to act may lead to a rise in unplanned pregnancies, unsafe abortions, and further jeopardize women's health across the country. Kelechi Amekalam, CGTN Abuja, Nigeria.